Good afternoon, everyone. This is Shiloh. My pronouns are he and him, and I'm the Affirming Ministries Coordinator of Edmonton, based out of the Robertson Wesley United Church. Today we are going to be doing the live stream about the blood ban. So many of you probably know what the blood ban is, and if you don't, the blood ban is essentially a ban on men who have sex with men. And there's a timeline in which they cannot donate blood due to the stigma of them having higher risk of HIV and AIDS. So we're just going to go through a little bit of the history, some of the policies around men who have sex with men, and then we're also going to talk a little bit about the trans policy within the Canadian Blood Services, and then talk about some ways in which you can kind of help fix this ban or push people to fix this ban. So some of the history about the Canadian Blood Services is that it is a non-profit charitable organization that is independent from the Canadian government, but it is mainly funded through provincial and territorial governments. The Canadian Blood Services has a multi-tiered system that allows them to measure the safety of the blood supplies that they do get. And for standard blood donations, before donating, donors are first screened for their health. The screening process for prospective donors includes things such as making sure the donor is healthy by asking if they've had any flu, sore throats, fevers, or infections. They also ask what medication some of the donors are taking. They ask if, you've left the country or go on... left the country, so your travel history. They also ask if you've had any vaccinations within the last 3 months. They also ask a lot of different medical history and also ask questions about their lifestyle. And so these are some ways in which the screening process happens for people who are donating blood. Hello, Pan. How's it going? Interesting topic today. Yes, I've been wanting to talk about the blood ban for quite a while, and so I'm really happy to be able to do that today. So once people are screened and they're able to donate, once the blood is donated, the blood then goes through testing for infectious diseases, including but not limited to HIV and hepatitis. The blood is also surveyed to monitor transmittable diseases in blood donors, investigated for possible transfusion or transmitted infections in blood recipients, and it's also scanned for potential emerging pathogens that may pose a risk in the present or in the future. And so all of these safety measures are done to protect the blood recipients. So the topic today is going to talk a little bit more about men who have sex with men. I know this is a very limiting title, but that's kind of what they've been calling it. Some of the acronym, I guess, is MSM. And so you might have seen that a little bit. So the policies around men who have sex with men is that they banned gay men from donating blood and tissues, and that was introduced in the mid-1980s. And so these policies were introduced after the emergence of several reported cases of this so-called severe immune deficiency among gay men in the United States in 1981. We now know that to be HIV and AIDS, and with the AIDS pandemic that erupted in North America. So in June 1982, there was a huge increase in the cases of this immune deficiency, and that was more in Southern California. But it led people to believe that the cause of this immune deficiency was linked only to sexual transmission of infection agents. And because this disease was prevalent among gay men, the disease was initially called the Gay-Related Immune Deficiency, or GRID, which is a really unfortunate name because, as we know now, HIV and AIDS is not just for the gay community. Anyone can get it, and it doesn't have to be sexual relations to get it. It can be anything to do with blood cross-contamination through needles, anything else like that. So hence, in the mid-1980s, the predecessor of the Canadian Blood Services, which was originally called the Canadian Red Cross Blood Transfusion Service, introduced a donor restriction on men who have sex with men. And that happened in 1977, on the grounds of protecting the blood supply from HIV infections. It wasn't until 2006 that the Canadian Blood Services began to conduct a thorough review of this donor restriction on men who have sex with men. But however, in 2007, the board of directors concluded that the restrictions were to be maintained. So this means that if you were a gay man and you had sex with other men, you were not allowed to donate at all. Upon this conclusion, the Canadian Blood Services were actually encouraged to gather more information on the subject. And in 2010, the Ontario Superior Court, in response to the Charters of Rights and Freedoms Challenge, which was launched in 2002, ruled that the deferral criteria for men who have sex with men was not discriminatory and that it was actually based on health and safety considerations. But then we see in 2011, the Canadian Blood Services, their board of directors approved plans to remove the permanent deferral for men who have sex with men, and instead agreed towards a defined term of not more than 10 years, but less than 5 years since their last sexual contact. So they had to wait at least 5 years, but no more than 10 in order to donate blood. And so that happened on May 22nd of 2013. The Canadian Blood Services announced that the deferral period was prescribed and enforced by Health Canada for men who have sex with men would be decreased from a ban for everyone since 1977 to just 5 years from their last male with another man sexual activity. And so that happened in 2013. So not that long ago, 7 years ago. Ooh, got a message here. Anna says that in the U.S. at least, gay men were some of the biggest blood donors, and this caused shortages while they had to readjust. Wow, I didn't know that. No, that's great. Thank you, Anna, for sharing that information. Yeah, definitely, and we even see that today where there's a lot of gay men who want to donate, but are unable to, especially with the Pulse shooting that happened in the States. There were so many partners and family members who were gay that wanted to donate to the victims of the Orlando shooting. But with the bans, they couldn't. So yeah, that's awful to hear. So it wasn't until June 2016 that the Canadian Blood Services announced that Health Canada had approved its request to shorten the men who have sex with men ban from 5 years to just 1 year with this policy change, and that took effect on August 15 in 2016. 3 years later, in 2019, we see that the Canadian Blood Services amended their policy again after Health Canada had approved their request to reduce the waiting period for men who have sex with men donors from 1 year to just 3 months. So this has been a huge change in the last 7 years. It went from not even being able to donate at all to under 10 years, to under 5, to 1, to now 3 months. So the Canadian Blood Services aims to keep its policies as minimally restrictive while also making sure that their blood supply is kept safe. Data from HIV in Canadian Surveillance Report in 2017 states that men who have sex with men, adults, are still the largest portion of new HIV infections in Canada at just under 50%. So eligibility is determined by the most current evidence-based research available, and Canadian Blood Services states that the 3-month waiting period exists because HIV is not detectable shortly after infection with its current testing technology. So they have to wait a certain period for it to be detected in their testing. So that's kind of the history of where the Canadian Blood Services comes from. But let's look at some of the critiques that the community has with these restrictions. Many critics say that the Canadian Blood Services should be using a screening model that evaluates risky behavior rather than that results in HIV, rather than basing it off of an individual's sexuality. And this comes from the idea that if a gay man is having unprotected anal sex in a committed monogamous relationship, they are so much more or less likely to have to be HIV positive than a man who has a secondary sex partners, or who's sleeping with other people, or even a straight man. And so a lot of folks are saying that this critique has nothing to do with sexual orientation, but rather has to do with risky behavior, and that the Canadian Blood Services is not taking that into account. And that's, yeah, Penn asks, what about people on PrEP? Even with PrEP, that doesn't result in being allowed to donate. They're still considered to have to do that waiting period. Even though all donate, and then another critique on this is that all donations of blood still go through an HIV testing, and approximately a 9-day window where HIV goes undetectable is the same for a gay man as it is a heterosexual man. And so a lot of people who are critiquing these policies are saying if gay men have to wait a 3-month period from having sex in order to donate blood, then that straight folks should also have that same restriction, because if HIV goes undetected for a while and they need a time period for it to show up, then they should be doing that for everyone, because everyone is at the same risk of getting HIV. It just depends on their sexual behavior. And so if a straight man is, having sex with multiple partners, they're more likely to get HIV than a gay man who is in a monogamous relationship for 20 years. And so weighing those costs should be taken into consideration, but it's not. We can even go further and start talking about transgender donors. This has been kind of more popular within the last little while. People are kind of talking a little bit of like, where do trans people fit in with this? And so from the Canadian Blood Services point of view, previously, there was ambiguity regarding the screening process for trans donors before there was a national criteria that was implemented. So on August 15th in 2016, the Canadian Blood Services created a new eligible criteria for transgender people, and this is the criteria. So donors, this is the first criteria, donors who have had lower gender-affirming surgeries will be deferred from donating blood for 3 months after their surgery, which makes sense because in part of the donation process, if you've had any type of surgery, you still have to wait 3 months, so that makes sense. And then they will be screened in their affirmed gender after 3 months. This is the issue. The second policy criteria is that donors who have not had lower gender affirming surgery will be asked questions based on their sex assigned at birth, and will be eligible to donate or be deferred based on these criteria. So the problems with these is that, for example, the first one, if a trans woman will be asked if they had sex with a man in the last 12 months, and if they respond yes, they will be deferred for the 3-month waiting period. So they will be considered to be a man who has sex with men. And so they'll have to wait the 3-month period in order to donate. And likewise, with the second one, if a trans man has had sex with a man in the last 12 months, even if they had not had gender-affirming surgery, they will not be screened as men who have sex with men, but they will be screened as a woman. Some of the other risk factors that the Canadian Blood Services tries to minimize the risks of is something called the transfusion-related acute lung injury, or TRALE is like the acronym. And this is particularly from trans men because it is more likely for donors who have had pregnancies in the past to have these sort of antibodies that are present in their blood plasma that can cause this transfusion-related acute lung injury in its recipient. And so because of that, it is very rare, but it can potentially be fatal. So in order to reduce this risk, instead of transfusing plasma proteins from donors at risk for TRALE directly to patients, their plasma is used to produce plasma protein products instead. And so the next risk factor is that relates to that first policy criteria is that trans individuals in Canada are not included in a separate risk category for the HIV and AIDS. And so that's why trans women donors who have not had lower gender-affirming surgery are placed in a higher risk category if they had had a male sexual partner. So some of these critiques is that transgender folks are screened with questions based on their sex assigned at birth. This then reinforces that transgender folks are not the gender that they are. And this is very stigmatizing and very much gender dysphoria inducing. Some of the other criteria that people are saying is that there needs to be more medical pertinent questions that are based on actual fact and not just bias. The policy, because it focuses on whether or not a trans person has undergone gender-confirming surgery, has nothing to do with their lifestyle. That's another critique that people say. If a trans woman or a man is intimate with a female, that person does not have to wait before they donate blood, and so they will be also screened by the sex they were assigned at birth. And there is no medical proof that surgery directly affects the safety of a trans person's blood. So if a trans woman has had bottom surgery, there's no data that shows that they're higher risk of having HIV or AIDS. And there's also, and so this goes with it, that there's no data that suggests that sexual anatomy, is of a person who is trans will have an impact on their HIV, syphilis, or hepatitis status. Other critiques state that screening trans people by their sex assigned at birth will discourage them from donating blood, which definitely is the response from me, and that's why I have not donated blood yet. And it reduces people to a surgical procedure, which is not accessible to everyone, and not everyone wants it. So it's clearly an outdated criteria. There's only one place in Canada, in Montreal, that you're able to get bottom surgery, and it can take 4 to 6 years to even get that. And that's if you want it. I know for me, personally, I do not want to have bottom surgery, and so I will forever, my entire life, be screened as a woman if I do get... if I do go and donate blood. And so just to sum up everything, the Canadian Blood Services has the criteria now, during this time, as being 3 months. And so if you are someone who identifies as male, and you have a physical penis, you are considered male according to the Canadian Blood Services. And if you have sex with other people who have a penis, you are considered a man who has sex with men, and so you have to wait a 3-month period after you have sex in order to donate. On the flip side, if you are someone who has a penis and you have sex with someone who has a vagina, you don't have to wait 3 months. And so the hypocrisy is quite alarming, I think, because you can get HIV from multitude of ways. It's not a gay disease. You can get HIV from a partner who has a vagina. You can get HIV from needles. There's so many different ways in which HIV can be shown and granted. And so my personal critique is that if you're going to have a sex ban and having a time period from the last time you had sex, I think it should be the same across the board, regardless of who you have sex with and what kind of anatomy you have. For trans folks, right now, if you had bottom surgery, you are going to be screened as the gender you are, which I think is kind of faulty, because the reason why they have that is because trans men sometimes hold this antibody that can be potentially fatal if they've been pregnant in the past. But for example, if I was pregnant in the past and I have that antibody, they won't screen me as female if I had bottom surgery. So the antibody is still going to be there regardless of me having surgery or not. So a lot of it is just so confusing and just doesn't really accurately represent us as trans people or folks who are gay. And so a lot of it is just stigma, a lot of it is fear, a lot of it is not based on data and research. And a lot of it is just based on the history of people just not understanding where we come from and kind of the history of that. And so for the allies who are watching, how are we able to change these? How are we able to protest these policies? And so I have a little bit of a list here for things that you can do. So I'll share that with you to end off this live stream. The first thing that an ally can do is, or even if you are gay or trans, you can ask someone to donate on your behalf. And those who are allies, you can donate to honor those who can't. So if you're eligible to donate, please do. And donate more for those like us who are unable to donate. The second thing you can do is, if you're if you're queer or if you're an ally, you can volunteer at blood drives, and you can spread awareness of the ban. So you can have a name tag that states your name, and underneath it you can say, "Ask me why I can't donate." And you can share that and spread this awareness of the ban and get people to be more involved in changing this policy. The third thing you can do is know who has the ability to change the policy. The Canadian Blood Services is funded by our government, so you can definitely ask and request your representatives to push for these changes. The fourth thing that allies can do, or if you are queer you can do, is support organizations that are working to change the blood ban. There are many folks who are trying to do this, but there's some other organizations that I found that do similar work on getting rid of the stigma. So some of the things here in Edmonton is HIV Edmonton. They do a lot of great stuff with testing and education and research, and so supporting them in any way you can help the Canadian Blood Services see that these are very outdated policies, so you can help them out. The other one is the Edmonton Men's Health Collective. It used to be focused on men's health, but they've definitely opened up their kind of focus and talking more with queer and trans health as a whole. And so they do a lot of stuff like this too, where they'll do push for health education, health research, and so helping them support research and finding data on a lot of these misconceptions within the health services. The other thing you can do with supporting organizations is pushing academics to research these risks. You can even see a list of the Canadian Blood Services research and call them and talk to them about funding more research into the men who have sex with men and a lot of these things that are prohibiting folks of donating. And you can contact Canadian Blood Services directly and give them feedback on their policies and request that they take a look into it more and really dive in a lot of funding to research why they're keeping this there, and maybe even doing feedback and telling them that if there is going to be a ban of 3 months after a sexual encounter, that ban has to be universal. And lastly, you can directly contact our health minister, Patty Hajdu, and request that she takes a look into this and make this a forefront as well. So those are all the ways in which you can help. That's a little bit of the overarching information about the blood ban, where it happened, how it's progressed in the last 7 to 10 years. So we've gone a long way from, gay men not even being able to donate to having a 3-month waiting period, but we're still not there yet. We still don't have equality when it comes to donating blood. Although donating blood is not a personal right, it is a gift of being able to donate blood. It's still unfair that there are many, many gay men and trans folks who would like to donate blood, but are unable due to these outdated policies. So do what you can as a queer person and as an ally, and try to help ban these bans, essentially. So that's all I have for today. If you tuned in late, feel free to rewatch this so you can get all the information. Unfortunately, I will be going on vacation this Saturday, so I will not be having an Affirming Reflections for the next 3 weeks. So I'll be back doing Affirming Reflections, let's see here. I'll be gone until the 20th. So July 20th, stay tuned for the next Affirming Reflections at noon. In the meantime, I think Robertson Wesley is going to be filling in with some other justice-oriented live streams, so stay tuned for that. For those watching, we do have 2 more events happening this week. On Wednesday at 6 o'clock, we're having a workshop called Breaking the Gender Binaries, One Word at a Time. It's going to be Wednesday at 6 p.m. Mountain Standard Time. It's free. Email me for the link. And it'll be an awesome 1.5 hours with a bunch of cool folks like Pan, who are going to be teaching us on non-gendered language and why gender is important in general. And then on Saturday, we're having a family-friendly drag show that's going to be on Zoom Saturday at 2 p.m. Tickets are $5 for an individual and $10 for a family or a cohort. So if you're interested in watching that, please get your tickets. They're going to be, they're on the Robertson Wesley website. I can definitely post the link here in the comments. So take a look at that. Feel free to buy a ticket. All the money is going to go towards the mission of Robertson Wesley, as well as some of the money will be donated to the Imperial Sovereign Court of the Wild Rose, which is the drag court here in Edmonton, and then the other remaining money will be going to the Pride Center to help with any of the Black groups and Black organizations that are in partnership with the Pride Center. So if you have the money to donate, please do so. If you want to buy a ticket for someone else, please do so. And if you want to come and watch, we will welcome you then on Saturday. And yes, Pan, unfortunately I have vacation. I'm moving next week, so it'll be nice to not have to work and move and go camping and just get a relaxation. So it's going to be sad not doing these live streams, but I'm sure I will be welcomed back with open arms on the 20th when I return. And yes, I will add the link in the comments once I end this, so I'll do that for you all. All right, everyone, I will see you in 3 weeks, I think. And in that meantime, stay safe, and if you have any affirming requests or comments, please feel free to email me, and I'll get to them when I come back. So I'm still here for the rest of the week, and I will see you all then. Take care, everyone. Bye-bye.